Southern culture. That's where we gather. We gathered around the dinner table. Food in Southern culture is just like it's life, it's family, and recipes have been passed down from my grandmother to my mom, and she passed things down to her son. It's just a unifying event. Like if there's a wedding happening, we're eating. If there's something sad like a funeral, there's food there. Food brings comfort, so I think it's very important here in Southern culture. Kitchen 27 came about because my brother Michael and we decided that our community needed something a little different. There's a lot of growth happening here in Bridgeville, South Carolina. So that was really the catalyst that kind of got us going. My brother and I, we travel a lot. We travel to many different countries, South Korea, Asian countries, Australia, and we enjoy eating. So we wanted to bring back some of our culinary experiences here to the Low Country, where we were born and raised, essentially, to the town of Bridgeville. We do a lot of infusion here with our cooking. We want to expand palates, so we would sometimes maybe pair our Southern style collard greens with South Korean kimchi. And we have folks in the community like, so what? What? It's pickled cabbage with some other things. And we would never try that. But then they tried it like, wow, I would have never guessed I would have liked kimchi. It's like we're expanding people's horizons. It's a really exciting time. If South Carolina was one dish, what would that be? It would probably be what our special is for today, and that's our Cajun-style shrimp and grits. I would say that's a pretty good representation of what South Carolina to me is. We are a coastal town, so of course we start with the fresh seafood, little Cajun spices. We do a Parmesan cream sauce, and it's really good, but also we are incorporating things like asparagus and fresh tomatoes. It's like a melting pot, a hodgepodge of things all together. So I would say that's what South Carolina represents to me. It's like people of all different walks, but it's just all good and yummy and you just want to eat it up. Do we use any family recipes at Kitchen 27? Oh, absolutely. That's all you're getting. I'm just kidding. No, like folks, they stop by like, oh my God, who made this baked macaroni? Like, what do you use in your, just a little cheese and noodles, but no, I'm not telling you, my friend, I'm not telling you. But no, there are recipes that have been passed down, but like I said, Michael and I, we travel extensively, so there are things that we know and love, and that's another part of our mission, I guess. We're gonna give you what you know. We're gonna give you the Southern fried chicken, the baked mac and cheese, collard greens, candied yams, potato salad, fried fish, but we're also going to present dishes like some Korean dishes, bibimbap and kimchi, or, not everyone has tried chicken marsala or sun-dried tomato roasted chicken pasta. Those are the types of things that we like to incorporate. So yes, we have our recipes to kind of get you in here, but once we've got you, okay, well, try this. Our menu changes daily, so try to give some people something fresh. This area is known as Pringletown. My last name is Pringle. This is where my grandfather and my grandfather's father, this is the area basically that they incorporated. So Bridgeville, South Carolina is the official name. But I mean, right off of Interstate 26, there's a sign that says, welcome to Pringletown. You look it up on Google Maps, it's Pringletown. So my father was born and raised in this area. Almost everyone in the area is a Pringle. This is our community. And we've had the opportunity and options to place our building anywhere else. And some folks are like, well, why there? It's small and it's so rural. And I was like, well, this is home. So that's why we decided to bring it back to Pringletown. I'll say Bridgeville, but that's why we decided to bring it back to Pringletown, because this is home for us. It's a sense of nostalgia. So when we established this, we wanted to bring something to the community that we owned and that can grow and progress in the future. And so far, things have been going very well. Pringletown has already been on the map for numerous reasons. We've got a few celebrities from the area, but just this is just an additional one, and we're proud of that. What I would say is unique about Bridgeville, it is the people. It's the South, so football, reigns supreme. Sporting events are awesome, so the neighborhoods come together. We have a good time, but Pringletown is just known for its community, I believe, and it's growing.
My husband and I and our chef grew up in Christian homes in a Mennonite community, and food was an important factor. It was kind of our love language.
The Mennonites have always been known for being good cooks, and a lot of their dishes have been handed down, and we actually use some of those in this very restaurant.
It's very important to us to use our recipes from our mothers and grandmothers.
Our roast beef special, that's something I grew up with. We just love serving good old comfort food.
If South Carolina was one dish, we would consider our Charleston croissant. And it is made with our homemade pimento cheese. It also has fried green tomatoes on it, which is very Southern.
I was baking cakes when I was just a youngster, still in the lower grades in grade school.
One of the main features of our restaurant, besides our entrees, is our homemade desserts. And as our restaurant grew, we outgrew our bakery area. And so our son has now moved 2 doors down and opened 158 Baking Company. And his baking company provides all of our baked goods, all of our pies.
We consider our desserts our wow factor. If somebody's unhappy and you set some dessert before them, they end up smiling almost immediately, and it changes their outlook on the whole evening. What we really like to hear is, "That's the best cake I've ever eaten." And we hear that often. Cheraw is unique in so many ways. We love the culture, we love the people here. It's about family values and laid back, and just enjoy life as you go. And we're here in historic downtown. We like that very much.
I love the rich history. We have a church that was built in 1770. It was used by 3 armies as a hospital. And we just enjoy being able to share our historic district. And so it's just a joy to be able to serve our community besides food, but also a nice experience for an outing.
According to the history, Cheraw was the last stop on the river for the river boats. And they actually have a port down here on the river. That's why we use the steamship logo, because the port was just right close here within a half a mile of the restaurant.
People in this community are very warm and very easy to visit with.
We just love this town. The town has been tremendously supportive of us. We like to try to give something back to them. We just love interacting with people. I never knew I loved people so much till we got into this business. And it's just been a joy to be here.
So here we are 10 years later and many prayers later, and we're very, very happy to serve our town and also visitors that come through.
Try to find an X. Everybody standing on an X if you can, and then spread out. We got a big room. Come on up a little bit. Well, welcome. We appreciate you coming. We'll try to bring you up to date on a number of points. We are happy to have Josie McDaniel Burkett here signing once again for us. Thank you very much. I'd like to call on Chaplain Douglas.
Thank you, Governor McMaster. Galatians 6:9 says, "Let us not become weary in doing good, for we will reap a harvest if we do not give up." Let us pray together. Heavenly Father, we thank you for another day of life. As we continue to live in this pandemic, we look to you for wisdom. Wisdom for our governing officials. Lord, I just pray that you would provide wisdom to Governor McMaster, to other state officials, Lord, and also to our national leaders, Lord. Lord, I also pray that you will provide perseverance to our healthcare professionals, to our first responders, to our teachers, to our nurses, to everyone who is serving diligently during this time. Lord, we also pray for your provision for our businesses and for our organizations, Lord. Pray that you would bless them and make them financially secure during this difficult time. Lord, ultimately, I pray for the people of South Carolina, and the people all across our nation, Lord. I pray that we would continue to be people of love, people of grace, and people of mercy, that we would love one another and continue to do good to one another. For it's in Christ's name I pray. Amen.
Thank you, We'll have a number of people to speak to you today, including Dr. Linda Bell, Dr. David Cole, Dr. Stephen Shelton, and Stephen White of DHEC. I'll start off with some comments on several points. The first is these are all important issues. And as you know, our state Supreme Court has issued a decision some time ago concerning the CARES Act funds. Obviously, I'm very disappointed with the decision. We had a rehearing, and still we were disappointed with that decision as well. Most importantly, I'm disappointed for the 5,000 or so students from working in low-income families who will be denied any financial aid from the CARES Act through the SAFES grant program that we initiated. That was $32 million. Many of these parents are barely able to scrimp and save enough money to pay for their child's tuition in independent Christian and other private schools. They do it to provide the type of education, environment, and instruction that they feel best suits the child's unique needs, and there are a lot of those. During this pandemic, with so much uncertainty and anxiety facing families, a child's displacement from the school they love and thrive at could have devastating consequences to their learning and emotional progress. I'm also disappointed that because of this decision, our independent and private colleges, including the historically black colleges and universities, will, as a result of this decision, be unable to access the CARES Act relief funds. I hope that this question can be resolved in some manner and resolved soon, perhaps by legal action by those institutions. I'd like to point out that it has been a common practice over the years for the General Assembly to appropriate money to benefit students at private and independent and Christian schools and colleges in South Carolina. And this includes need-based grants and financial aid, as well as scholarships funded with revenue from the state lottery. We do have a contingency plan for repurposing the CARES Act funds. They will be directed at providing educational opportunity, choice, and access for students from working and lower income families who have been adversely impacted or displaced due to the COVID pandemic. As to schools, South Carolina must have an educated and trained workforce to compete for jobs and investment. And the competition for jobs and investment in the southeastern part of the country is going to be fierce as it was before the pandemic hit. And this will go on into the future. We cannot afford to keep schools closed at all any longer. We can't afford it for as long as we've had them closed. In July, I called on all the public school districts to give parents the option to send their children back to school in person 5 days a week, or the option to choose virtual instructions. Some schools did it, most did not. To keep classrooms open and safe, I directed the Department of Administration to provide personal protective equipment for every school district that requested it. This was months ago. We have repeatedly offered to provide whatever personal protective equipment any of the school districts wanted. And Kim Stinson is here with the Emergency Management Division. We have millions of gloves, masks, all of that, and it has not been requested. There's a lot available now on the commercial market, but there's no reason for these schools not to be opening if what they need is personal protective equipment, because we have an abundance of it. Over $10 million in PPE was shipped out this fall in response to my offer. School districts in our state have also received over $400 million in CARES Act funds to help bring the students back to the classroom. 2 weeks ago, I directed the Department of Health and Environmental Control to provide every school district with COVID-19 rapid tests. Those are the BINEX tests. For many South Carolina families, schools provide the only opportunity for parents to go to work. The only opportunity. Many working parents cannot stay home with their children every day. They must go to work to pay the bills and provide for their families. Parents should not have to choose between their child or their job, but that is what the decision of the school districts who have not gone back to 5-day face-to-face education are requiring these parents to do, and it is not the right thing to do. In October, my office surveyed the 15 school districts that started the year providing in-person instruction. That's 15 school districts out of 79 that started the year with in-person instruction. This was done to learn what practices and policies were working, which ones were not, and what, if any, additional support was needed to ensure the continued safety of the students, teachers, and staff. The answer was continuous communication with teachers, staff, and parents across numerous media platforms allowed these districts to adapt and evolve their health and safety policies and procedures in order to keep the students in the classrooms. The students, the parents, the teachers, the districts were communicating, collaborating, and cooperating, and they've opened safely, and they've been doing just fine. And also in our private school system, independent school system that serves approximately 50,000 students, they have, I believe 99% of them have been open 5 days and have had very few, if any, problems. This week, I sent a notice of upcoming results of this survey to every school district superintendent in the state and encourage them to share the survey with their local school board members. It is my hope that this information will help them provide to parents the option of 5-day in-person classroom instruction. The survey is available now at accelerate.sc.gov. Ladies and gentlemen, there's very little that I can do to open these schools that we have not done. I do not have the authority to make the school districts make that decision. I cannot do it because I do not have the authority. Had I the authority, I would have done it a long time ago. But there's ample personal protective equipment. There are ample procedures and policies that have been used successfully. These children not being in school are having enormous unintended consequences. People all over our state are going back to work. We have a 4.2% unemployment rate. People are working. There's no reason for these schools not to be open. The consequences of these children, some of whom were marginal in their learning to begin with, the consequences are going to be enormous, and we cannot afford that. We've got enormous competition, fierce competition, economic. We've got to educate our people for the skills, the education, the things that they need for the future if our future is going to be bright. Across the nation and in South Carolina, infections and hospitalizations are rising. It appears that many people have let their guard down. I know we have fatigue from all the things that we need to do, but now is not the time for us to let up. Now is the time for us to redouble our efforts. When the cold weather comes, people go inside with the windows shut, with a lack of circulation, and that's where this virus spreads. That's when when they're close together in various settings, that is the best opportunity for this virus to spread. So that is here, that is upon us now, but we know what to do. We have learned over the months, we've heard repeatedly from this podium as well as others around the country what we need to do. What we need to do now is determine that we're going to follow those best practices and keep the spread of this virus down. Wearing a mask when social distancing is not possible. Washing your hands routinely. Being courteous to others, courteous to your family members, courteous to visitors, courteous to your customers. Go outside, get fresh air, keep your windows open, but follow those rules that have been stated so often that we've all memorized them by now. Following successful procedures and protocols has allowed our schools, businesses, restaurants, manufacturers, and our state government to operate safely and securely. Again, we need to redouble our efforts. Vaccine. This month, the Department of Health and Environmental Control will begin receiving the vaccine this month, December. It is estimated that our state's first allotment will be between 200 and 300,000 doses. I want to caution everyone, this will not be a fast process. I want to caution everyone, this will be a slow process all over the country. Most South Carolinians will not be vaccinated for months. So we've got to keep our guard up. Now is not the time to let our guard down. There are different phases or steps in this process of delivering the vaccine. The first step, the first phase, called Phase 1A by the CDC, to receive the vaccine will be the workers or individuals in healthcare settings that are at the highest risk of contracting COVID-19 and are essential to preventing mortality of others. Some examples are, and there are a lot of them, I'll read them slowly, but these are the example of the first group that will be receiving the vaccine in South Carolina and elsewhere according to the CDC rules, regulations, and recommendations. The first group will be, and there won't be enough of the vaccine for all of these, as you understand, physicians, physician's assistants, nurses, nurses' aides, physical therapists, respiratory therapists, speech pathologists, medical students, nursing home and long-term care facility residents and staff. Also, medical personnel in correctional facilities, jails, and detention centers. Also, this is Phase 1A, the first step, medical emergency first responders such as EMTs, paramedics, fire, and law enforcement personnel. I hope that was slow enough for everybody to get it. Also, home health and hospice workers. Those will be in the first group. The next group will be workers or individuals who provide services and which have a high risk of exposure due to interactions with the public. Examples include, again, I will read them slowly. The remaining first responders, including fire and law enforcement personnel that don't have face-to-face contact in emergency situations with the public. Workers in jobs that provide critical services such as utilities workers, water, trash, transportation, waste removal. That includes bus drivers, Department of Transportation workers, and others. Also, in this second phase, agribusiness and food production workers. We have to keep those providing the food for the rest of us. And those will be in processing plants, canning facilities, and others involved in food production. Persons who live or work in congregate settings like group homes, homeless shelters, correctional facilities, jails, and detention centers. Also, in this is Phase 1B under the CCC's statement. I would call it the second step, a second group. This continues to include people aged 75 or older and persons with 2 or more of the following risk health conditions. These following conditions: cancer not in remission, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV/AIDS, obesity, pregnancy, and sickle cell disease. 2 or more of those. The next group, Phase 2 it's called, includes this: pharmacists and pharmacy technicians, grocery store, food service and food delivery workers, service industry workers, postal workers, public transit workers, K-12 school teachers and school staff, child care workers and staff, school bus drivers. Are you getting all this, Ms. Burkett? Okay. Instructors and staff at higher education institutions, including 4-year colleges, technical colleges, and research universities, and persons age 65 or older, and finally, persons with one of the following health risk conditions. And you heard these a moment ago: cancer, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV/AIDS, obesity, pregnancy, sickle cell disease, asthma, cerebrovascular disease, good gracious, corticosteroid. How you say that? Corticosteroid. That's it. Cystic fibrosis, hypertension, immunocompromise, liver disease, and pulmonary fibrosis. So that's a little longer than the first list. But you have to just have one of those. The final phase will make the vaccine available to the entire population, which includes the vast majority of the population. But again, what we have to remember is that this is going to be a slow process. Now we have worked on our distribution system for the vaccine for some time. We are confident that among DHEC, the EMD, and the National Guard, it will work, and we're ready to do it. But we urge everybody to have patience and want to remind everyone that even though the vaccine is coming, that we've got a long way to go before we have managed our way out of beyond this virus. So I urge everybody again to remember those simple things that you're supposed to do. Wash your hands, keep your hands away from your face, you pick things up from things you touch, wear that mask, keep your social distance, and try to get as much fresh air and stay outside as much as you can. With that, I'll turn the program over to Dr. Linda Bell from DHEC. Doctor?
Thank you, Governor. And I appreciate being here with my colleagues and others who are here to help address what more we can do to stop the spread of COVID in South Carolina. Because this has been an extremely difficult year. So many illnesses, so many lives lost, and very unfortunately, we're not near the end of this. And in fact, over 239,000 probable or confirmed cases have been reported among South Carolinians, and 4,500 people have died from COVID in South Carolina. So with the recent news of the promise of the vaccine trials, this gives us great hope. But as the governor has commented on, it's going to be quite some time before we will realize the promise of having significant coverage for the majority of our population in South Carolina that would allow us to stop the prevention measures that we're recommending that are very effective. And our case numbers here in South Carolina have reached an unprecedented level, here in South Carolina as well as in the country as a whole. Our data points are worsening, unfortunately. So when we look back at just a little over a month ago, when 35 of our 46 counties were in a trajectory that for at least 1 to 6 days, they were in a downward trajectory. And now, just a little over a month later, only 6 of our South Carolina counties are in a downward trajectory. And just last week, we reported 2 of the highest days of cases since the pandemic first came to South Carolina. So with more than 13,900 South Carolinians last week alone being reported, that many cases in a single week, it makes this last week the worst it has been for us since the beginning of the pandemic. And nationally, the case counts are rising, hospitalizations, deaths, we're seeing this everywhere, and it's impacting our ability to share resources. It's impacting the ability for healthcare workers to travel from one jurisdiction to another to help, because we are all now pretty uniformly being affected across the country. And these sort of dire statistics are very personal to me, because every possibly preventable death that I hear about, every community member that is at fear of going to work or for fear of sending their children to school, when there is more that we can do to prevent this. And in fact, no one else should have to die from COVID-19, but unfortunately we will see more deaths. But the fact that it is within our power to control a great deal of this with the resources that we have at hand now is something that I implore all of you to pay more attention to. And there are recent projections from the Institute of Health Metrics and Evaluation that tell us what it might look like for us here in South Carolina if we continue to do what we're doing now. And that is by April of 2021, if things don't take a different course, we stand to see an estimated 1,000 deaths. So what that means is that from the end of November until the beginning of April, an additional 3,000 more South Carolinians may die if we don't do something differently. But the good news about this is that in these projections, they also say that if we were able to implement 95% use of masks within a week, that by that time in April, we could actually avert an additional 1,000 deaths. We could avert 1,000 more deaths. And in fact, if we were to do this 95% mask coverage within about 4 to 6 weeks, by the beginning of the next year, we would see a significant difference in our trajectory. So when we look back at what we looked like a month ago and where we look forward to what we could look like a month from now, there is significant control that we have over what we're seeing. And this public health is not about politics. The virus doesn't do its harm or doesn't spare people based on your political beliefs. We have to follow the scientific evidence in making decisions about what we're going to do. And so if we understand that this virus is spread by what comes out of your nose and your mouth, and that could possibly kill you, then if you cover your nose and your mouth, then you can save lives. And this is the level of control that we have over our trajectory in the near future. And the other measures along with mask wearing, the physical distancing, if we understand approximately how far the virus can spread, and we stay that distance away from others, whether they are our family members who we are welcoming into our homes during the holidays, or they're people that you don't know, then you reduce your chance of exposure. And while we're seeing approximately 20% of the people that we test are positive, that tells us that there's a great deal more disease in the community that is currently undiagnosed. So the more people that you gather around, the more you increase your chances of being exposed. So we absolutely need all South Carolinians now to do everything that they can to contribute to controlling the spread of COVID, to change our trajectory. Over the summer, we saw our cases surge after those holidays, and we can't continue to tolerate these surges and these downward trends. So if we take these measures, adopt these measures, and practice them consistently and routinely, we won't see these additional surges. We can get ahead of this pandemic while we wait for the promise of the vaccine. And it is true that we're very excited about the projected effectiveness of these vaccines, but the fact that they will be in limited supply for those who are, initially, for those who are at highest risk of being exposed and highest risk of suffering severe consequences, that it will be some time for significant coverage in the population as a whole. But that time will come. The plans to roll that out are somewhat complex. It involves the distribution plans, making sure that the vaccine is where it needs to be and that people who need the vaccine can get it. But we have in place, we are and can make those complex plans, but simultaneously we have to take the simple steps that are at our disposal. So while we can accomplish these plans, in the meantime, we have to use the measures that are at all of our disposal with the masks, the physical distancing. And I'm excited that we're working with many of our stakeholders to help us make these decisions in the state for the equitable distribution of the vaccine, to make sure that any barriers that may currently exist, particularly for those in rural areas who don't have adequate access to care, and where there aren't currently mechanisms in place for mass vaccination for those who may need it. We're working with our stakeholders to identify where those places need to be, and we're making plans to get the vaccine there. So I just want to end by saying that that I hope we can look back at this point in time right now as our watershed in this pandemic, that it was at this time that we made decisions that resulted in a change of our trajectory and that we did not go back up again. And that in the meantime, while we're waiting on the vaccine and we look forward to the time when there will be ample supply for everybody, there is a great deal more that we can do in the months to come to put us in the best position. So thank you.
Thank you. Dr. David Cole, President of MUSC.
Thank you, Governor. Appreciate the opportunity to be here today. I want to start by thanking everyone who has done their part to help stop COVID vaccine. And over these past months, we have made a lot of positive gains. And for also encouraging your loved ones around you to do the same. Since we came together to face COVID this past spring and summer, we have been able to deal with the virus. And we've been able to do our best to manage in our daily lives. We've started to rebuild our economy. We've grappled with how to best educate our children. And also how businesses can continue to move forward and see and serve their customers in a safe manner. MUSC and health systems throughout the state are working around the clock to care for our communities until we reach the end of this pandemic. And we will still be there for you at any point in time. Just to state it, from where we stand, our best and quickest path forward is the safe administration of effective vaccines to everyone in our community. The challenge is producing, distributing, and administering these vaccines to enough of the population. I, like every citizen of this state, look forward to the day when we can safely say that COVID is behind us, along with the need for masks, for social distancing, and hand washing at every moment. The hopeful news, as you've heard, is that we're getting close to the approval and distribution of safe and effective vaccines. Additionally, I think it's worth noting that we're starting to have access to new COVID antibody therapeutics for those who do contract the virus. Although now we can start to see the finish line, and fatigue has definitely set in, we must be careful not to stumble at the end of this marathon. This marathon ends not when we give the first vaccine, it's when we give the last vaccine. It's important also to understand that the risk and potential impact of COVID has not somehow magically gone away. It doesn't just end because we've endured it for a long period of time. This virus is surging, you've heard the numbers. You see every night on the nightly news what's going on across the nation. It's also happening in South Carolina. We've learned and have proven that we have the tools in hand needed to manage the virus. We must continue to follow through on practicing excellent hand hygiene, social distancing, wearing masks, and protecting the vulnerable, through the winter and holiday season especially. To do otherwise will cause unnecessary suffering, loss, and hardship for our communities and those we love. During this holiday season, I understand and share the temptation to gather as we have always done. But we've come too far, and so many people have sacrificed too much for us to falter now. So please, especially now, stay diligent. Now's not the time to let our guard down. Make smart and safe decisions for yourselves and your loved ones. The best way to keep our economy moving forward and our loved ones safe is for all of us to work together, because the decisions we make today will define what we face next. For me, this year, the best possible holiday gift is the gift of a safe tomorrow. Thank you.
Thank you, Dr. Cole. Dr. Stephen Shelton from Prisma Health Midlands.
Thank you, Governor. It's hard to imagine we're close to 1 year into this process. We're all feeling the fatigue. We recognize that in the community. It's very stressful. It's becoming even more stressful as we move into the holiday season. But it is not time to let our guard down. We're excited about the new vaccine and the potential that it has. And we've heard here that that's not an immediate fix. I want to reiterate what has been said here numerous times. Those public health preventive measures are the way we need to go, and we need to continue. Simple as social distancing, 6 feet, wearing a mask when in public or exposed to others. Make sure you're washing your hands frequently, avoid gatherings, and stay home if you're sick. Those are the key pieces that'll get us through until we can get enough the vaccine or our immunity throughout our system. Now, we do have challenges with the holiday season. We recognize that is a difficult time for all. Most of us recognize the fun times we've had with large gatherings with family and friends. However, we need to reflect on those that we put at risk for that. Our elderly family members, such as parents or grandparents, those with weak immune systems, those with chronic health conditions like diabetes, obesity, or lung disease. We're putting all those individuals at risk. These are the individuals most likely to be hospitalized and potentially even die from this condition. So we ask during this time that you avoid those large gatherings. If a gathering is a must, we recommend that you keep them small and outside where there's good ventilation. In addition, we want to discourage any kind of buffet during these, where those will touch the utensils multiple times by multiple individuals. So again, some basic pieces there that we want to recognize. We've already begun to see some of the effects of Thanksgiving. What you do at this time or not do will impact what our healthcare system looks like in the future in the coming year. Currently, we reached a grim milestone this week within healthcare. We have 1,100 statewide hospitalizations for the coronavirus. We have not seen this number since this summer. Prisma Health has felt that impact ourselves. We currently have 225 positive patients within our healthcare system. That is close to our summer record high at this point. Now, Prisma Health has remained committed to doing our part. Daily, we evaluate our bed status, our staff, and our equipment, such as our PPE, to make sure that all 18 of our facilities can provide care for the coronavirus patients, as well as the other sick and injured that are within our system. So it is time for you to step up as the public. It is not time for you to let your guard down. It's important. We're all in this together, so it's important we follow those measures that have been mentioned here so we can all move safe into this new year. Thank you.
Thank you, Doctor. Dr. Stephen White, Stephen White, DHEC, Immunization Director.
Thank you, Director. Taylor. So good afternoon. As you are aware, we have been preparing over the last several months here at DHEC and with our partners here at South Carolina. We've been preparing to receive and distribute COVID-19 vaccine for some time. It is anticipated that states will be receiving vaccinations within the coming days. We look forward, as been mentioned, we look forward to the day when we'll have enough vaccines to vaccinate all South Carolinians, but the amount of vaccines that we will initially receive will be small, and this means that we need to figure out who will be vaccinated first, as the governor has already mentioned. South Carolina does expect to receive between 200 and 300,000 doses by the end of the year, and then we anticipate receiving additional doses on a weekly basis after that time. South Carolina's vaccination plan was carefully and strategically developed in consideration of who should receive the first doses of vaccines, with the ultimate goal to prevent as many new COVID-19 deaths as possible. While not all who wish to receive COVID-19 vaccine will be able to do so right away due to the limited supply, we want to stress that it is not a no, but rather a not now. DHEC is confident, however, that there will be enough vaccines for the general public in the next year. Since September, DHEC has been meeting with our partners at the Emergency Management Division, the National Guard, SLED, South Carolina Hospital Association, and other key partners as the state's COVID-19 task force. And the task force focuses on planning, logistics, communications, and financial considerations for COVID-19 vaccine distribution. Like other states, South Carolina's vaccine plan has greatly evolved, and we will continue to do so over time as the federal government provides new vaccine information. In fact, our new vaccine plan can be found on the COVID-19 website. In addition to the task force, DHEC has established an external vaccine advisory committee, which is facilitated by Dr. Bell and others, and it's comprised of members representing a wide variety of stakeholders in South Carolina communities. And one of the primary focuses of the Vaccine Advisory Committee is to facilitate community input that assists in planning for the fair and equitable distribution of COVID-19 vaccines. Among those, most important to this fair and equitable distribution are our state's vaccine providers. We will need as many providers as possible to help administer the vaccines, especially as vaccines become more widely available for the general public. Any provider who would like to receive and administer COVID-19 vaccine is required to enroll in the federal vaccine program being coordinated by DHEC. They must successfully complete the CDC's required COVID-19 vaccination provider agreement form. DHEC has also been working very closely with the CDC's long-term care facility partnership. The CDC partnership will coordinate and vaccinate all South Carolina long-term care facilities and community residential care facility residents and staff beginning at the end of the year and through the early part of 2021. The CDC Long-Term Care Partnership will provide Moderna vaccine to all those long-term care facilities and those community residential care facility residents and staff. As mentioned, both the Pfizer and vaccines will be made available in time, but in time with an emergency use authorization from the FDA. In the clinical trials, both vaccines demonstrated upwards of 95% effectiveness in reducing the severity of COVID-19 illness. FDA will be reviewing the emergency use authorization for Pfizer on December the 10th, which is tomorrow. FDA will be reviewing the emergency use authorization for Moderna on December the 17th. The two vaccines are understood to be equivalent in efficacy and safety, and both the Pfizer and Moderna vaccines require individuals to receive 2 doses or 2 shots. For Pfizer, it's separated by 21 days, and for Moderna, it's separated by 28 days for those 2 doses. And individuals will need to also be sure to receive both doses of the same brand of the vaccine, as I've discussed before. The COVID-19 vaccines we will soon receive will have different logistical considerations for storage and handling, more than any other vaccine that we've ever had in our history. The Pfizer vaccine, which will likely be the first vaccine that we will receive and be available to states, is known as the ultra-cold vaccine. It's required to be stored at -70 degrees Celsius or -94 degrees Fahrenheit. The Moderna vaccine, which is the next vaccine to be made available, is a frozen vaccine, and it's required to be kept at -20 degrees Celsius or -4 degrees Fahrenheit. South Carolina has logistics and planning in place for safely and securely storing these ultra-cold and frozen vaccines and helping transport them to our enrolled providers. Additionally, the state is also looking to plan for mass vaccination efforts to help ensure vaccines are easily made available for the general public as more vaccines become available in the coming months ahead. It's important to understand that the vaccine is an incredible step forward in our fight against this pandemic, which has already been stated. However, the vaccine isn't an immediate return to normalcy. These vaccines will help us to not be able to spread the vaccine. I should stop and I should correct myself on the spot. These vaccines will help us not become as sick from COVID-19 as we could, but the vaccines don't prevent against the spread of the virus. All of us, even after we receive COVID-19 vaccine, will need to continue to wear a face mask, practice social distancing, and practice hand hygiene until our public health officials recommend otherwise. And lastly, I recommend and I remind everyone that no steps were skipped in the development of the COVID-19 vaccine. All vaccines are held to the same rigorous scientific trials, processes, and research before they can be made available. Protecting public health is the reason why vaccines exist. We will continue to provide the most current and factual vaccine information available for South Carolinians as we can. Thank you.
Thanks, Stephen White. So as you can see, the development of the vaccine is a big step forward, but it will be months before we feel the impact of that. So in the meantime, we have to redouble our efforts, follow the rules, do what we've been taught to do. That is, wear your mask and get one of these, get a new one several times a day, or at least every day, or cloth mask. You have to wash it. We all know those things. Keep that social distance. The virus spreads in the air. It hangs in the air for a period of time. Wash your hands. In just a second, I'm going to scoot this on my hands because I've been touching this, and a couple of the others have as well. And if you're sick, stay home. Call the doctor. But remember this, we have, I think, about 300 testing facilities open right now in the state. They're all over the place. And you can find them on the DHEC website as well as the Accelerate SC website. Most of them, I believe, are free. All the public health ones are free. So if you want a test, go get it. They have the different kinds of tests, and now we have the Binax test coming as well that is very, very easy. You can give that, do that one yourself. And so we have all the tools that we need, but we as citizens must take it upon ourselves to do what we know we must do. That's the answer, is every person in this room and everyone in our state, because this is a deadly, deadly virus. If there are any questions, and I want to say also, we've got the whole team is on the field. I mean, in our state, we communicate, collaborate, and cooperate, and the amount of collaboration and communication and planning among all of those involved in this is quite something, and it's very effective. And that's one reason we've done as well as we have done in South Carolina. Any questions? Yes, ma'am.
Governor, once the vaccine becomes widely available to the entire population, would employers be needing to require their employees to get the vaccines in order to come back to work?
I don't think so, but I don't know. That'll be a question for the law. There are a lot of the pros and cons on that. But the important thing is the vaccine will be available. Yes, ma'am.
Governor, you said to stay home if you're sick. We're seeing 2 school districts that went back to virtual because they don't have enough staff members and teachers to be able to teach the students that they have. Obviously, these districts also have PPE, but they just can't keep their teachers well enough to continue teaching. What do you say to those who've had to return to virtual because they just don't have the staff present to teach students?
Well, we have the Binax test, which only takes 15 minutes. They're readily available. We have there's plenty of testing sites. If everyone will practice the type of hygiene and carefulness that we've been speaking of, and you know from the numbers that we've seen, people are not getting the virus in school, they're getting it at home or getting it somewhere else. That's where they have to be careful. If everybody will follow those procedures, get the tests, and take care of themselves and follow the same procedures that have been outlined in the survey that my office did with, then follow those rules, then they should be able to go back to school just like all others. I remind you, there's schools all over the state that have been back at 5 days, and they're doing just fine. So those that are not need to see what they're doing and do the same thing or adapt those to their situation. Yes, ma'am.
11 or so school districts have decided to opt out of
I
that.
couldn't hear you.
11 or so school districts have decided to opt out of that rapid testing recommendation that you have put forward. What is your response to school districts who have decided not to do it because they have concerns that parents, for example, would send their sick kids to school to get tested?
I don't understand that, frankly. I think we have those tests available. They're available, they're free, and I've been tested 11 or 12 times. There's nothing to it. They ought to do it. We need to get the children back into school, or we're going to be paying the price for that for decades.
Exactly when were those tests distributed? Of the participating districts, when were those
Binax test, I think, went out last week. I believe it was last Monday, or became available last Monday or Tuesday, I believe. Yes, ma'am, in the back.
It's obvious that a lot of people aren't following healthcare protocols, wearing a mask, social distance. all of those things. So what's the next step? How do you get people to understand they need to do these things?
Well, the next step in many of those cases is they go get sick, or someone that they're close to is going to get sick. You can pass laws and people will not follow them. Everyone in our state, everyone in the country by now knows what they must do. They're easy steps to take to prevent the spread of the virus. Everyone ought to do those things. That is the answer. It's an individual responsibility. They must do it. Shauna?
While we've seen the number of cases spike above July, we have not seen the number of deaths correspond to that. So why is that, and what part of the therapeutics that Dr. Cole mentioned play a part in the deaths so far?
Well, that's good news, and that is an important number. And one thing, if you look at those ages, the young people are not the ones that are getting very, very sick and dying. It's the older people and the vulnerable ones that the same category that the vaccine will first be distributed to are the ones that are at risk. But Dr. Cole, would you like to respond?
Sure. I think there's two parts of that question, which is where the deaths in terms of correlating with the number of illnesses. Just a reminder, there's a long lag time between the numbers that get reported when somebody goes to the hospital and ultimately when somebody dies. So I don't want to be morbid, but stay tuned. And we have not seen, if you look in the state of South Carolina, our numbers historically the last 6 months have reflected the national numbers, somewhere in the range of a 2% mortality. So I'm always an optimist. I hope that there's some good mojo occurring that would allow the numbers to be less, but I don't think you can assume right now, because the numbers showed yesterday that the numbers that reflected in deaths, that they're not going to occur. You know, we're seeing the sequence is, just to state it, the numbers that people get ill, eventually there's some sub-segment of people, probably somewhere between 5 to 10% that end up hospitalized. You know, of those that end up hospitalized, about 40% up in the ICU, you know, and it's from there, it's very tenuous. The second question with respect to the therapeutic antibodies, every step that we've had in this foot race has been more demanding because of the consequences of lack of supply and the demand. So there has been approved an outpatient infusion of a monoclonal antibody that theoretically in a high-risk patient who's not in the hospital could be administered and minimize their chances of getting more ill and then into the hospital. That's the great news. And I know that there's several hospital systems across the state are trying to get access to that. The bad news is that for the entire nation, until the end of December, there's 300,000 doses for the entire nation. You know, so I can tell you, I reviewed the numbers this week. Last week, MUSC administered 25 patients with our monoclonal antibody. It requires an outpatient setup. It requires identifying the individuals. It requires them, you know, coming to and wanting to have that. But I would anticipate, as we continue to move forward, just like testing, just like the vaccine, that there will be more approvals, there will be more volume, and we'll have more ability to provide, in my opinion, what is a buffer between the community illness and the hospitalizations that subsequently happen. Thank you.
Yes, ma'am.
I have a question for Mr. White about vaccine distribution. You mentioned after the 300,000 doses that the state will receive, we should be receiving additional doses every other week after that, or?
No, so we anticipate, until we actually receive vaccines, we can never say we have them. So that's always the tricky part. We anticipate that we'll have 200 to 300,000 between now and the end of the year, and we'll end up getting some each week. And then we anticipate after that time, so after the first of the year, we'll understand as production ramps up with Pfizer, Moderna, and any other vaccines that might come up for an EUA application as well, such as AstraZeneca or Janssen Janssen, that we would hopefully have a better idea of what we're going to get on a weekly basis. And I don't know if that's going to come on Monday. I don't know if that's going to come on Friday. And so that does put us in a little bit of a position to where we are providing numbers. And then if those numbers don't come to fruition, we don't get those numbers, we have some explaining to do on where that's at. So it's all based on the allocations on specific pro rata algorithms done from the federal government.
Just a quick follow-up question. If you're saying the current estimate is 200 to 300
200, 300,000 doses, does that mean that would cover about 100 to 150,000 people?
So yeah, so that is not correct. So what we are anticipating getting are going to be first doses. The CDC is actually going to be handling the second doses on the back end. So they're not asking the states to handle the second doses at the state level. What they're going to do is allow us to identify the 200 to 300 individuals that could receive the first vaccines. And then they will, in time, when that 21 days or that 28 days is up, when it's due for the second dose, they will then put that into a booster dose allocation for us to manage at that point.
Regarding the vaccine, will some immune response begin after the first dose, or will it take until the second dose?
I'm sorry, I did not hear the question.
Regarding the vaccine, will some immune response begin after the first dose, or will it take the second dose?
So that is to be determined. So ACIP is still to meet later this week after the EUA is either approved or not approved. And so ACIP will provide their findings off of that EUA. So they'll provide that guidance.
Governor?
Governor, actually, I have a question for the governor.
Okay.
Yesterday, your counterpart in North Carolina announced curfews and some other restrictions. What do you think of his decision, and why not, with the seriousness of what we're talking about, impose them here?
Well, the different governors, different states are doing things different ways. I'm confident, I believe that we are doing ours the best way. We are not going to shut down South Carolina. We've seen other states do that. It wrecked their economy. It wrecked a lot of businesses. It wrecked a lot of families, and now their rates are going back up again. So that's closing down is not the answer, because when you close down a business, then you are potentially killing that business or taking that property away from that individual. And there's a constitutional question involved there, and there have been some court decisions on it, but there's a better way, and we all know what the better way is. And here's part of it right here. Put this on your hands all the time. Wash your hands, wear that mask, keep that distance, stay outside if you can, avoid crowds, get tested. If you're sick, go home, call the doctor. If everybody will do that, we'll be able to manage our way through this. But remember, as long as one person has got the virus, if they're in North Carolina, Georgia, or somewhere else, if they come here, if there's just one person, then this can all start all up again. So we've got to be very careful. Yes, ma'am.
Governor, I think there's a lot of confusion, especially in 5 Points, where we see all these college students going out and wearing their mask in line, but once they get inside the bar, they just immediately take it off and start clustering together. I spoke to the head of the 5 Points Association a few weeks ago, who tells me, his hands are tied. He still thinks it's confusing why, kids can go inside and automatically that rule is gone. Can you address some of those confusions or concerns? As
Well,
that's telling us not to
what we have done on that. Of course, the school is, most of the colleges and universities will be letting out or going home mid-December. That may answer part of the problem, may shift it to somewhere else. But we have an 11 o'clock rule where alcohol is, the service and sale of alcohol is over. That is still in place. That is one of the several things that we do have still in place. But again, when you go into the big box stores, when you go into Walmart, when you go into grocery stores, you go into the thousands of businesses around the state, and they all have signs up, and they say wear your mask and all that. They're under no requirement to do that, but they're doing it, and that's good, and that's what every business in our state ought to do.
Governor?
Yeah, back to
I have a question for Dr. Bell. Dr. Bell. Many of our school districts in the state are reporting that they don't have the space to social distance 6 feet apart. In some instances, they're closer than 3 feet. And we're also hearing reports of some schools not fully following mask mandates and the social distancing. Hearing that and seeing 2 schools go back to virtual, how concerned are you about spread in our schools?
Well, I do think that the measures that are in place in schools on the whole are more stringent than they are in the community, as we were just discussing. But we have provided guidelines for the schools to do everything from staggering schedules, made recommendations and do visit with the Department of Education and individual school districts routinely. We work closely with the school nurses. with our recommendations to make sure that we're revising them as we get input from the schools directly as to the challenges that they face in trying to follow these recommendations. We will continue to see some cases. Again, we report cases that, and the report comes out as cases associated with schools but not acquired in schools necessarily for students and staff members. And we don't see significant evidence of transmission within schools, but at the same time we recognize the importance of, this is prolonged contact that the teachers and the students have to be. It's different from if you're in a big box store or something like that and you can limit your contact. You have to stay in one place and you have to be there for a period of time. And that is something that meets the definition of a close contact if those measures aren't in place. But, and so the positive aspect of this is that for the most part, we believe that schools are doing their best, that they're managing. We continue to see concerns in the community though, and I just want to reinforce the message that we have to make our community safer to make our schools safer.
And by seeing the community spread, rising, ultimately some of these schools have had to close because they say they don't have enough staff. If we don't get the community under control, will these schools be able to operate with, without the spread of the schools? Will they have enough staff?
Well, I can't speak to what the schools will have to do if they don't have sufficient staff and they will take measures to have virtual learning and things like that. But our role in public health is to provide the guidance that we understand from the science based on how we know the disease is transmitted, of the things that they can put in place to prevent contact. And then they have to work with those challenges, and when people get sick and they have to go into isolation, and when they're contacts they have to go into quarantine, we recognize that that puts an impact on school staff and on the workforce as a whole. It's true also for our healthcare providers. And so this again just tells us that each and every one of us needs to do everything that we can to reduce spread within the community as a whole, to protect the schools, the businesses, the healthcare system. And there's just a great deal more that each and every one of us can do with the routine use of the prevention measures that are available to us.
Dr. Bell, there are some communities that are incredibly wary of getting vaccines. We've seen reports of that over the last few weeks, especially within the Black community that are very concerned about it. I'm wondering what is DHEC's role in kind of the messaging of people who are worried about getting vaccines once it does become open to the general public?
We are aware of the skepticism of not only the COVID-19 vaccines, but unfortunately there is hesitancy about other vaccines that have been widely available for a long time. We see this every season with the flu vaccine. We see it with childhood immunizations. So part of it is to reinforce the message that the COVID-19 vaccine is no different than these other vaccines in the research, the development, the clinical trials that it has gone through, or that the various products have gone through to assure their safety, to assure their effectiveness, and so those that continue to have hesitancy, we have a communications team that we're assessing, what is the basis of this hesitancy and what can we do to explain to people that that the vaccine is safe, it is effective. We do want people to know what to expect though. As with all vaccines and with all drugs, there can be some symptoms associated with taking them. So when people get the vaccine, they may have a sore arm, they may feel feverish for a day or so, may feel a little achy, but that doesn't mean that the vaccine is not safe. That's your body's immune system responding to the vaccine. And so we want people to understand clearly the difference between the safety and expected side effects. And with the African American community in particular, there are historic reasons why they have this hesitancy. And one of the messages that we want to explain is because of this, the hesitancy that comes out of what has happened historically with the African American community is actually those sort of shameful practices that were put in place decades ago are actually the reason that there is research oversight. There's the reason that there is patient consent. It's the reason that clinical trials have to be conducted in a certain way, and that the FDA and the vaccine manufacturers have guaranteed that they would not put a product out until it had met those stringent requirements. And so the result of that historical the shameful things that were done historically, is that we have things in place now in the scientific and the research community to prevent that from happening again.
And Governor, have you reached out?
Ms. Adcox?
You mentioned that there won't be enough vaccine even for the first, everyone in phase, who's eligible in phase 1A. How do you break out who within phase 1A gets those first doses?
Well, we have an allocation plan for the healthcare facilities, and we are giving healthcare facilities some latitude in making decisions within their facilities who is at highest risk. We know that from one hospital to the next, they may have access to more resources. They may have more shifts. If we have a small rural hospital that has limited staff and cannot really afford to lose their limited number of intensivists or something like that, then that healthcare facility might make a different decision about the number of staff that need to be vaccinated versus another facility that has a deeper bench, if you will. So we can provide the guidance about who may be determined to be at increased risk, but then healthcare facilities, including not just the healthcare providers, but those who provide other services within healthcare facilities that are essential for diagnostic purposes, the laboratory workers, the x-ray technicians, and so forth, everything that's needed to provide care to preserve life, then those facilities have some latitude in deciding who within those facilities it makes the best sense to keep them operational.
How many people make up Group 1A? In Phase 1A, how many people is that total?
So we have estimates of healthcare providers, but the Group 1A that goes to some of the other groups that the governor mentioned, we have estimates within all those populations. And what we do understand is that initially we won't have enough supply, and this is why there's the need for those difficult decisions about who will get it first. And we are putting in place everything that we can to assure access to the vaccine, especially, again, as I say, in underserved areas, in rural healthcare facilities where there may be the only healthcare providers. And so those estimates are available. I can't quote them to you now.
And Governor, for you.
Ms. Adcox?
If I could go actually back to the beginning of the news conference where you addressed the CARES Act $32 million. You said that you have a contingency plan for that. Can you detail what that plan is?
Well, we don't have the details of that plan, but we want it to go, of course, to education, and we are looking for all the ways to do that now. But we regret the decision made by the court that affects not only that $32 million, but also funds going to the historically black colleges and universities and others.
We have time for 2 more questions. We'll start here with
Yes,
that.
sir.
And why do you think, you mentioned these protocols at the top that we've been following and that you've been telling people from that same podium for days now. I was wondering, why do you think now the public response to your messages of caution will be any different from the same messages that we've heard before?
Well, our numbers went way down before. We were among the best in the nation with the response that we took both in and out of government. You remember our Accelerate SC provided enormous insight and information for what to do. But now has been mentioned that we're at a watershed moment where it's getting colder. That's going to result in more people being together, close together. Also, we're at a moment where we're about to get the vaccine. This is a unique moment. So what we are emphasizing with the people is now is not the time to let up. Now is the time to redouble our efforts. Help is on the way. Things are going to get better, but we cannot let up our guard. So if people know this is not something that's going to last forever, this is something where we can see the light at the end of the tunnel, we believe and hope that the people will take care of themselves and others. Yes, ma'am.
Governor, as we're fighting this pandemic, are you satisfied with the pace of the search for the new DHEC director right now?
Am I satisfied? Well, I wish that we had found. I wish the ones that we had stayed, but it's a very important position, and I know that the board is very actively seeking just the right person to take this position. Yes, ma'am.
A quick follow-up to Mr. Taylor, Director Taylor, if you have a second.
He has had no questions yet.
I know, that's what I did.
Yeah, thank you.
Today, the Senate President, Harvey Peeler, said he pre-filed legislation to restructure DHEC, splitting the environmental and the healthcare side, or the health side. I want to read you a quote that he said today in a statement. He said, "No one is in control at DHEC and hasn't been for quite some time." And he said that this legislation will, quote, "ensure government runs more efficiently and will give each agency clearly defined responsibilities." What is your reaction to this pre-filed legislation? Do you agree with that?
Well, I believe that leadership has been in place. Obviously, I'm there. But the legislature may have different ideas about how DX should be restructured, and that's certainly within their purview. And whatever the legislature decides, that's what we'll do.
Do you have a personal reaction to the splitting up of DHEC?
We'll do what the legislature asks us to do.
Thank you, everyone.
But I'll tell you who's in control. It's this man right here, Director Marshall Taylor. Y'all, thank you very much. We appreciate it.